Hey guys, for the last topic, I got kind of excited. I didn't really know anything about this topic, so I was interested in it. When I was reading in the textbook, I read about the STAMP program, which is now called the SNAP program. It stands for the Supplemental Nutrition Assistance Program, so that's where food stamps come from. And I thought it was super interesting, and I wanted to look into it because I know nothing about it. And the textbook just said, basically, there's a program that aids people who are struggling with the ability to purchase food, but it's underutilized and no one uses it because they don't want to be looked at as poor or anything. So I thought it was super interesting, and I wanted to look more into it. And so I did. So the news article I found was actually from 15 days ago. And it's even, there's like a second part that was like just 2 days ago, I think. But I chose the 15-day ago day one, and it's titled USDA Announces Actions on Nutrition Security. Secretary Vilsack to give speech highlighting the U.S. Department of Agriculture's robust efforts to tackle nutrition insecurity. And so the theme tied with the SNAP program is nutrition security. And that means like how well off you are in your nutrition, if you're able to buy the foods that provide the right nutritional needs for you, for your age, and your like status. So nutrition security is a big deal in the United States right now, and the SNAP program allows people to better receive those nutritional benefits. But nutrition security builds on the important work of USDA and its partners, and they are trying to promote food security by increasing the department's focus on diet-related chronic diseases. So they said that the big issue in this article, they said that they're trying to use this program to target people who may be in risk of these chronic diseases, and this program can help them receive the nutrition that they need to prevent or make the chronic disease better. Because right now it is a big problem. They said that families with children and people in more isolated areas of the country, including tribal communities, are disproportionately affected by the toll of diet-related chronic diseases. So it's a big deal. We may not know of it based on like our economic standing, but it is somewhat of a problem. They went over a plan with 4 strategic approaches to leveraging these assets. The first one is called Meaningful Support, which is providing nutrition support throughout all stages of life. The second was Healthy Food, which is connecting all Americans with healthy, safe, affordable food sources. The third was Collaborative Action, which is developing, translating, and enacting nutrition food sources. Enacting nutrition science through partnership. There we go. And then the last one was Equitable Systems, which is prioritizing equity every step of the way. So that's their 4-step, they call them pillars for this program. And the other things that they did to be able to average out this nutrition security was 4 different things, which was modernizing the WIC, the WIC, for eligible mothers and their children to better meet their nutritional needs, to build on the successes of school meal programs by issuing transitional nutrition standards, the helping SNAP participants make the most of their benefits, so letting them know what it includes and when they can do it, And then the last one was focusing on nutrition education efforts across all nutrition assistance program. And there's about 5 different ones. One of them's like My Plate. The other one would be WIC, but there are other ones. And so that's their plan as of 2 weeks ago, to better help support nutrition security. The journal article I found was called Food Stamps, Food Insecurity, and Health Outcomes Among Elderly Americans. And this was kind of related a lot. They talked about food nutrition security, but it was more focused on the elderly instead of just in general. They examined associations between very low food security and the health outcomes of older adults. And so people that were using the SNAP program, they were interviewing them and doing little tests to see whether or not the SNAP program was helping them with their nutrition security at their age. They found 3 different results. They found that found a negative association between food insecurity and general health condition, which is the self-rated health and grip strength test that they did. They became statistically insignificant conditionally on the SNAP participation. Second, they found that SNAP does not moderate the association between food insecurity and depression. And then the third thing they found was that there was quite a bit of evidence that the association between SNAP and depression operates indirectly through a decline in self-esteem. So it wasn't quite as related as they had hypothesized. They had thought that using the SNAP program would increase their mental problems, including depression, but it just turns out to be that it's just with age and with self-esteem. And so they came to the conclusion that the SNAP program is beneficial. For those who do need it, it would be a great benefit and tool for them to use. For the code of ethics, I didn't know where to go to, but I found a good section. It's called Social and Political Action, section 6.04. And subsection A says social workers should engage in social and political action that seeks to ensure that all people have equal access to the resources, employment services, and opportunities they require to meet their basic human needs and develop fully. Social workers should be aware of the impact of the political arena on practice and should advocate for changes in policy and legislation to improve social conditions in order to meet basic human needs and promote social justice. So this section in the Code of Ethics is basically saying, in terms of the SNAP program, when you do meet or if you're working with a client that is in need of using this program, that they should talk to them about it and help them get started with the SNAP program so that they can become self-reliant, and if they need the help, they have the tools to receive it. So it was all about the resources and letting them know about them and allowing them to use them. So that was the Code of Ethics. And then I guess the last question I will leave you for this semester is, based on what you've heard about how the SNAP program is underutilized, how could the U.S. government help people understand the SNAP program better and use the resources that it provides? So what can they do to either let people know about it or advertise it maybe? So just your thoughts about how they can implement that better into our system. And I won't see you next time, but it's been a great semester. Thank you.